Voices. Let's talk, you and me. What's going on in the community? Real people, real voices, real issues, real choices. What's happening? Where you living? Who's taking? Who's giving? Let's talk about it. Real people, real voices.
Welcome to Real People, Real Voices. I'm your host, Reverend David W. Green Sr.,
I'm your co-host, Pastor Wayne Moore.
and we have with us.
Curtis Baker, your producer.
Yeah, we're
This is a little different format this time.
We're gonna do something a little different
I'm at the
tonight.
beginning and I got lost myself.
That's all right.
we're glad to have you a part
Thank
of
you
our
very much.
discussion on this evening. Pastor Moore, can you give us our sponsors?
Yeah, I sure can. The Concerned Clergy of Indianapolis, the Baptist Ministers Alliance, Tamiko Associates Realty Group, His Place Eatery, Al's Modern Clothing and Shoes, Marion County Public Health Department, Northwest Window Gutters and Cleaning, Marion County Sheriff's Office, and Rodney Stepp Music Productions, and Lavinia Summers Home of Funerals. Those are our sponsors, and we appreciate you.
Yeah, we appreciate all of our sponsors, and we want to encourage all our viewers, go to our YouTube and subscribe to our YouTube channel, Real People, Real Voices. Also like us on our Facebook page, Real People, Real Voices. Now, part of our motto is, let's talk about
Yeah.
it. And what we want to talk about on this evening is the governor, next level agenda. He's talking about his plans for the state of Indiana. And we need to talk about our plans for the state of Indiana, what we would like to see. So I want to encourage you. We're going to take a break. I want you to come back. Let's talk about it. Let's talk about what the plans are and how we, as Hoosiers, are going to be impacted.
Let's talk about it. Real people, real voices. Real people, real voices.
Welcome back to Real People, Real Voices. We want to talk about Governor Holcomb has a plan, next level agenda that he's hoping that the legislative session with the Senate and our representatives will pass. Part of his agenda, at the top of the agenda, was health in Indiana.
And wellness, yeah.
And health and wellness. There was a commission that was in place, and he's allocating dollars to help address some of the disparities and issues that we have as a state. Some of which is right around mental health, which I find to be phenomenal, given where we are. In terms of social determinants of health, in the country, we're like 44th. So we've got a long way to go. So I think it's great that we're seeing our governor be intentional and say, we need to address the health issues in Indiana. And then both of you gentlemen know that when it comes to health disparities, we, especially as African Americans, have been lagging behind. So I'm hoping that these improvements, these resources that would assist public health departments, these things that are intentional, addressing mental health, and because we really have to address the stigma, gentlemen.
You know what?
A lot of times we don't want to talk about mental health,
That's right. That's right.
Those things are important.
You know, you said something that is so profound. 44th in the country. For 2023, he wants to do 120 million, 24 or 25 maybe, somewhere in one of those years, to get it to 2025. That is still low compared to other states as it relates to mental health. There's not really, Dr. Green, in my estimation, and Brother Baker, a urgency as it relates to funding, where funding can really be seen to make a difference. And when we see these dollars go out to these organizations, these mental health organizations, health organizations, well, my question is, will that be enough? Will that be enough?
Who's in line to get this?
Well, most state organizations, health organizations.
First.
Well, I mean, they're starting with the public health organizations, and you know, I am being optimistic that the first Senate bill number one,
Yeah.
is around mental health.
Yeah.
Okay.
And I think that's hopefully setting
Precedent.
priority,
Okay.
that we're going to make mental health something that we need to address across the whole state of Indiana.
Yeah.
And, the thing about mental health, it not only impacts the urban community, it's impacting rural communities as well. So I'm hoping that everybody can come together on one accord and support the governor's plan. There's senators that are already on board. It's Senate Bill number 1, and hopefully the House will join it. The representatives will join it and support that we need to do and make that kind of investment in Hoosiers.
Yeah.
Because now what we're talking about is not property investment, but people investment.
Yeah,
Right.
which has, in many cases with this legislative arm, has always been kind of difficult to have a strong human concern in the state of Indiana. And hopefully this might be able to put us in a position to where people can see now that maybe the legislators are changing their minds about the people of Indiana or Hoosiers, whether it be urban or rural, because it is very, very needed. And not only that, he's still wrestling, and this is when I talked about dollars, Dr. Green, with the opioid crisis, because it was funded, but it still needs to be funded. And so those are the kind of things that worry me when I hear like a 120 million and then 225 million in so many years to come. It's just not enough resources because, in my estimation, because mental health is becoming an urgent issue in communities like it has never been before.
Because it's happening across the entire state. So there's a number of things needed that require, obviously, dollars, whether that's, the various forms of treatment, whether you're going to need something that's going to be inside a part of a facility, or those outside, or the people to do the work. All of that requires resources and requires dollars. So I'm sure we're not funding it, Dr. Moore, to the level that's going to be needed. We just got to certainly begin to head in the right direction, because we do have to put people over property and other things and say we need to get this done.
So again, I'm asking that question, like who's in line for this? And you said state agencies, but how does that trickle down into the community? I mean, can you be more specific on
Well,
these states?
part of it is the public health department, so that they're saying the Marion County Public Health Department will get some dollars.
Okay.
Some of our hospitals are certainly parts of this as well.
Who have the mental piece in their hospitals and things of that nature. Yeah.
Right.
Okay.
Because clearly some of the hospitals don't. When you go across the state of Indiana, it's part of the problem, is that some of our hospitals do not have those facilities in place. And in many cases, they are transporting them to
An hour away.
an hour or so away to the IU Healths of the world.
Yeah.
And so those facilities need dollars to do the treatment, as well as just new facilities that need to be built, need to be staffed. So it's a critical need. And in addition to the normal health needs that we're seeing, prostate is an issue. Diabetes continues to be an issue.
High blood pressure.
High blood pressure is an issue. Cancer is still an issue. And so we want to see improvement in these areas.
Immunization, child.
Yeah. The impact of COVID, right?
Yeah.
So we're all trying to, when you're the leader of the state, you have some challenges in this, and we're hoping that and believing that there will be some synergy around supporting the agenda to start to head down a path that says, hey, let's improve the health of all Hoosiers, because believe it or not, sooner or later, we're all going to probably need it. The cost of prescription drugs is continuing to be high. I know that's a part of the governor's plan as well, to try to bring down some of those costs. Because again, that could consume some of the money, right? Because is it enough? But part of that comes from, well, if the prescription drug is so high, I don't know. I mean, you probably don't have enough. And can you leverage those items and have those difficult conversations across some of our.
And then the children that are dying, I can't think of what Representative Summers has always pushed that idea of birth rate, the children that.
But, yeah, premature
Deaths.
death, infant, premature death
infancy.
rates, right?
Yeah.
That's always an issue too.
Yeah. So we have a lot, man. We have a lot of health issues
It's a lot of help.
going on right in our state, and that are not addressed properly as it relates to funding. And the more you put Band-Aids on these particular situations, the sore seems to come back again.
Well, I think a lot of times we keep doing the same thing over again, using the same mechanisms and the same entities to try to fix or correct a problem. But I don't want to get into that right now because we're about to run out of time. This is my producer hat on. I'm looking at the clock.
All right.
But I want to talk about that, and we got some more things we want to talk about that was on the governance list when we come back.
We'll definitely do that.
Did I just-
We'll
did I
follow
just
your
do-
lead.
did I just do your-
We'll follow your lead. We'll take a break, and we'll be right back.
Hey.
Let's talk about it. Real people, real voices. Real people, real voices.
Welcome back to Real People, Real Voices. We're discussing Governor Holcomb's next level agenda. We've talked about healthcare, but now we want to talk about education. He's looking to increase the funding in terms of education,
For K through 12.
K through 12, because we need more teachers.
Yeah.
We don't have a number of people participating in the 21st Century Scholars Program, so we need to get more children going, taking advantage of that. Our business community, especially in Indianapolis, has been asking, hey, we need better trained, educated people to take on these
Workforces,
jobs because some of them are looking at leaving. So I'm excited to see that there's some movement again in this area of education, because education is key, and it needs to start at the beginning.
You know what, Dr. Green? My definition of a teacher is one who produces others for professions, to be professional. And that's why it's so important
Interesting.
for teachers to be paid adequately. And so he's trying to do it in his new agenda to at least add $3 more thousand a year to teachers. And you're definitely right. Our city is crying for an educated workforce. And we have, for some years, dropped the ball on that. And the living wage is a piece of that. It's a piece of that. And so this is going to be interesting to see how the General Assembly addresses this particular issue as it relates to education. Another piece, as I want to say in passing, he does not address the affordable housing issue, but he is addressing the other issues, such as this.
Well, I agree. I mean, that affordable housing piece is one of the reasons you probably need to give an increase to those teachers, right? So if you've got new teachers you're trying to recruit or to retain, they got to make enough money to afford housing. In our state. But all this is around money, right? There's money being spent for health care, money being asked for in terms of education of our children, public schools, et cetera, funding. There's a look at that funding matrix for them. All of those items are critical for making a better Indiana.
$5 billion is what he's trying to, in the process of time, $5 billion is what he's trying to pour back into the Indianapolis economic, not economic, but back into the communities. He's trying to do that. He's trying to do that.
Indianapolis
not
or
Indianapolis,
Indiana?
but I'm talking about the whole state.
Okay.
Indiana.
In Indiana, excuse me.
Okay.
He's trying to do that. That's going to be a pretty tall drink of water for the legislators, isn't it?
Well, I think that, the governor started out saying we have a huge surplus.
Yeah.
And he's willing now to demonstrate an investment in people so that, we have the surplus from which to do it. So the discussion and the debate, I'm sure that's going to be taking place in the Capitol, will be those who say, we don't want to spend anything in this surplus, we want to grow the surplus, versus those who will be saying, well, it's time for not physical infrastructure,
Right.
but personal
Personal.
infrastructure.
Human infrastructure.
Yeah,
Human
there you go, there you go.
infrastructure investments to be made. That, you know, we've done enough, quote unquote, on the interstate systems.
Right.
What we want to do now is say we want to invest in people. So I'm excited about the potential of investing in humans, in people, so that we have a better Indiana. People want to not just pass through Indiana as the crossroads of America, but really want to come and live here, can raise their families here, can, you know.
But it's
have
a
good
breath
job.
of fresh air, to Dr. Green and Brother Baker, to hear them talk about the human infrastructure now,
Right.
because it's always been, and economic development is a part of
Absolutely.
it's a part of his piece, his space on his new agenda. But at the same time, he's talking human infrastructure, and we haven't heard that from the legislation for a while, or even from the governor. So I think this is, like you say, I'm excited just like you are to see how far it will go and how
Right.
much of his agenda will be accepted. When we talk about, since we're talking about education, there is a piece in there for Martin University. The $10 million that one time, which I disagree with, because other colleges get a yearly
Absolutely.
situation from the state of Indiana. But $10 million one-time disbursement to Martin University, that's going to be interesting when we talk about education, K through 12, et cetera, teachers' raises, et cetera. He's got a hefty educational agenda that is going to be worth looking at.
Real people, real voices.
You mentioned earlier the 21st Century Scholar. So did I hear you right? That said there's not enough participation in that?
It's not enough of our children are participating, so they're looking to incentivize that.
Why do you think that is? Because
It shifted. Dr. Green, remember,
Yeah.
at one time, it did not need to be affected.
Okay.
It was effective.
Let's talk about it. Real people, real voices. Real people, real voices.
Speaking of that, you mentioned earlier the 21st Century Scholar. So did I hear you right? That said there's not enough participation in that?
It's not enough of our children are participating, so they're looking to incentivize that and try to get parents to participate in the program. Eventually, we'll need to have a show just around the 21st century.
Why do you think
Scouts
that?
program.
Why do you think that is? Because
It shifted. Dr. Green, remember,
Yeah.
at one time, it did not need to be affected.
Okay.
It was effective, if I
Right,
could say,
absolutely.
before they affected it. And so now they're finding out that the decision they made about the 21st Century Scholars, when they did that, it might have sounded good and looked good then, but it has become.
Can you
problematic.
elaborate on that a little bit? Because
Well, go ahead.
And,
Yeah.
I mean, I'll just try to give you an example.
Okay.
They changed the law so that initially you sign up, person was an eighth grade,
Eighth
et
grade,
cetera,
right.
you sign up.
had several
Now-
family members.
Right, but in the course of that, you have to almost make sure you stay at the threshold in terms of revenue. So if you went and got a job that made $11 or $12 an hour, and when you start out you were only making 10, you could now be thrown off of
the
it.
list.
Off of it. And then when you think about the impact of COVID, et cetera, and so many people lost jobs, well, you know, now, you know, somebody would certainly be eligible, but because they had in
Right.
2019, they made, you know, $50 too
More.
much. And so
And
those
not taking into
things,
account of inflation and everything else going up. It's like,
exactly. So then you
Wow.
have a number of people who got kicked off, a
Mm-hmm.
number of people who say, well, I'm not making that vow to poverty
Right.
for the next 4 or 5 years. So those things have to go back and be looked at
Absolutely.
versus initially, hey, if you fit the criteria
got
and
it.
your son or daughter was in the 8th grade,
You got it.
you signed up, you were in the program.
Okay.
And you didn't have to worry about, hey, did I get a raise at McDonald's? You know, because I'm wanting employees, I'm paying you $16 an hour. But that if I take that job,
Right.
my child loses this college
That's-
benefit.
yeah.
So then, you know, in the future, we're going to have to, you know, bring people in who deal with this 21st Century Scholars Program on a consistent basis to kind of share, and because you still got to manage to that.
Right.
It's something still that has to be managed too, and so it won't be as simple as saying, well, just everybody sign up, because people will look and say, well, I ain't committing the next 5 years to stay this way. I'm trying to get a job.
Right.
I'm trying to move forward. And, in doing that, and I don't want somebody to make a vow to poverty. I want them to get jobs and make livable wages and move forward. Now what does that mean for that child?
Right.
So those are the questions that have to be addressed.
Could we have our sponsors
Oh,
before we
sure.
close out?
Yeah, let's do
Close
that.
out?
Yes, sir.
The
what we're
concerned
gonna
clergy,
do? Yeah, let's
the
do it
concerned
that way.
clergy of Indianapolis, the Baptist Minister Alliance, Tamiko and Associates Realty Group, His Place Eatery, Al's Modern Clothing and Shoes, the Marion County Public Health Department, Northside Window and Gutter Cleaning. It's about that time. The Marion County Sheriff's Office, Rodney Stepp Music Production. He made our jingles. It's great. Lavinia and Summers Home for Funerals are our valued sponsors here on Real People, Real Voices.
Go right ahead.
Well, it's going to be an interesting session. A lot could happen. We need to stay tuned. At Real People, Real Voices, I'm sure we're going to be talking about this as we go.
Because it's a long
through.
session. It's a
It's
budget
a long
session.
session. It's about money, and economics is in this. And people have different views about how to spend the money, and so that'll be a part of our discussions as we continue through 2023 and what will actually pass. So when we get to June or July, what new laws will we have here in the state of Indiana? How are our children impacted? How are our families impacted? It bears and is important that we pay attention.
I just want to say, man, I want to thank the staff for setting us up today. It's been a great opportunity to be out in the community right here at the Madam.
C.J. Walker,
C.J.
Legacy
Walker
Center.
Legacy Center. Man. Thank
And
our staff,
thank you.
people behind the cameras, and
Our producer did a great job.
He did with his new jacket. He did a great job. All right, close us out, President.
All right. Well, thank you for joining us on this evening. Hope to see you next week. Remember, Real People, Real Voices. We want to talk about it. God bless you.
Good night.